Hi, my name's Mary Bartlett, and I'm running for a seat on the NAMI-New York State Board of Directors. I wish we could be in person and I could tell you about my enthusiasm and experience that make me a good fit for the NAMI-New York State Board of Directors. I hope this virtual platform gives you just as many ways to connect and engage with people as you would in person. I know that my professional experience as well as my personal experience makes me a good candidate. Dealing with depression and anxiety from the time I was young, growing up in a rural area where there wasn't many services, and now being a professional advocate and government relations associate, I know what it takes to advance a mission and to share that perspective with the legislature. I've never felt more welcomed or understood as I have in NAMI events, and I hope to bring that to more people in a role in the board of directors.
The reason that I want to serve on the NAMI-New York State Board, primarily I think is because I want to be that person for someone that I needed several years ago. Even that person that I needed last year, the person I needed 3 months ago. NAMI was there for me when I needed them most. And this is my way of giving back to the organization because of my experiences with them. I believe that I can be a positive asset and a positive role for the organization.
Hello, my name is Jasmine Cruz, and I first wanted to thank everyone from the nomination committee for allowing me this opportunity to share a little bit about myself, even though it's virtual, not in person, but we're doing the best we can and under the circumstances. I'm very eager to help in the capacity of being a board of director in the NAMI-New York State. I currently serve on the NAMI Orange County Board of Directors, and I've been doing that for a little bit over a year. I think if I said that I wasn't nervous when I started the process, I would be lying because it was very intimidating for me as it was my first board. But then, the board was welcoming and able to answer all my questions and really allowed me to have a seat at the table and have a voice. And I think that that was the biggest thing for me, was really to be heard. And I really hope that if I'm selected for the board, that I'd be able to provide that support for others. And I'm hoping that they'll be welcoming to me and my ideas.
Hi, everyone. My name is LeClair. I served on the NAMI-New York State Board of Directors this past year and learned a great deal about NAMI's mission. As a nominee, I would like you to consider me for another term on the board so that I may contribute to supporting and advocating for families who are experiencing mental health issues.
Throughout my, time in college and working as an academic and working as a researcher, I've worked with many programs and organizations that have helped and worked with individuals who were either struggling with circumstances around their mental illness or with their mental illness, and also working in the state system, in the hospitals, and an outpatient. I became aware of the need for organizations like this for two reasons. One, because a lot of resources that we don't have and can't provide, and also gives us a sense, or gives me a sense of what the community needs. But an organization that stands out in terms of the exception of work they do is NAMI, and I'd really, really like to contribute more. And the way I see myself contributing more is by joining the board and being more involved in the regular day-to-day stuff.
I want to give NAMI a voice out front and also to help bring positive change for families and peers, and to also bring the NAMI message out there.
My name is Julie LeClair Neches, and I wear two hats. I am both a clinical psychologist, and I am also the mother of a daughter with bipolar disorder who passed away at age 25. I would love to have the honor of serving on the board of directors of NAMI New York State in order to advocate for needed legislative changes. I also would really want to be part of a team. What is most critical for me is to continue my daughter Alex's legacy. She passionately fought for the rights of those with a mental illness, and she also came out publicly in an article while still in college to say that she had bipolar disorder so she would no longer feel alone. I would love to have the honor of continuing to serve on the board of directors.
I served on the NAMI Rochester board for 6 years as secretary and then as president before I was hired for the affiliate to be the executive director. Now that I'm retired, I'm still very passionate about this dynamic peer and family movement that has been part of my life since 1990. I attended my first meeting after my 18-year-old daughter was first hospitalized and later diagnosed with schizophrenia. I was so impressed with the information and support that I received that evening that I immediately joined the organization. I have remained inspired and proud to be part of this national movement, and I would like to offer my time to continue to support NAMI's mission. I started my journey with NAMI serving on the local board of directors, and I am ready, willing, and able to continue my journey with the state board in order to advocate for quality of life for individuals and families affected by mental illness.
Because NAMI has served me so immensely in my life. I have lived with mental illness since I was 15 years old, and now at 25, I cannot imagine being here without the help that NAMI has given me. When I was in college, I started NAMI on campus to start facilitating conversations around mental illness on our campus, and I worked as the development director for NAMI North Carolina when I lived there for a couple of years. And the programs that NAMI provides, the advocacy that NAMI provides is just so immensely important for people with mental illnesses. And I really want to be a part of that. I really want to continue my journey with NAMI and continue to make it a better organization that truly serves everyone who lives with a mental illness.
To be another important, memorable, creative, relatable, engaging, great personality, passionate, interactive, helpful, and never give up attitude, point of view on mental illness and how I'm helping everybody with their important mental health. Also, to use all my passion from my own mental health life experiences in giving value to help everybody with their mental health. I'm excellent with sponsorship with my own concept of follow-up and service equals reputation, reputation equals referrals, and referrals equals money. And also a never give up attitude in helping the board of directors and everyone else involved with NAMI New York.
I think that there's a lot I can bring to the board. As I mentioned, my day job is in advocacy and government relations, and I've lobbied on a lot of mental health issues in the past. I've done it from the patient and provider side, I've done it from the family side, and I know how important change at the policy level can be. It's really important to me to make sure that NAMI has a voice at the legislature and would just love to contribute to the great work you're already doing. And while advocacy is my specialty, education and public awareness is also so important. Support is equally as meaningful as parts of NAMI's mission, and breaking down stigmas is something that I'd really like to help work on. It's such an important thing, and taking the time to understand and educate people is truly a mission and a passion for me.
I feel that there's three things that I bring to this board. The first is passion. As I've stated before, and my experiences have really shaped me into who I am, my experiences with my husband and his mental illness. And that passion, I believe, transcends into the work that I have provided NAMI thus far and that I would continue to provide NAMI. It's incredible to be a part of something that is not only bigger than yourself, but is such an important and crucial part of everyone's lives. It's just a great organization, and that's one thing that I bring. I also have connections with the Elizabeth Dole Foundation as I'm the New York State representative. I also have positive relationships with political affiliates, which I think would be an asset, of course, to the organization as well. But one of the most important things that I bring is experience. Experience with crisis, experience in highs, experiences in lows, experience as a family member through all the entire spectrum of what that means. And also I bring experience as a board member with NAMI New York State now, as well as board member with NAMI Syracuse, where I'm the veterans chair for both organizations.
In terms of what I can bring to the board, I definitely assume from what I've read and what I've heard is that a lot of people on the board do not necessarily look like me or have my lived experience, and I hope that I would be able to contribute that and add to the diversity of the group, and be able to bring a different lens and possibly some innovation, which is a great asset to any group.
I have lived experience in having lost a child to suicide, and I would like to put in place support for those who have had the same experience. I feel it is important for families to have resources to support them through their grief and have help in navigating the healing process from the very beginning.
I think that I have a good amount of experience working in the research fields for about 9 years now. 8 years at Office of Mental Health under RFMH at Manhattan Psychiatric Center. And during that time, I've also been a professor of psychology, has given me a lot of insight into the field of research and what is needed in direction for CNS, central nervous system type studies. I have a fairly good understanding of the particular fields, and I'm always open for more feedback and more information. And I think what I can bring to the board is a good amount of experience in the research field, a good amount of experience working with individuals with severe mental illness, and a good amount of understanding of possible directions we can go in terms of collaboration between research, advocacy, and group programs.
Leadership skills, knowledge, caring, and compassion, and the ability to be a team player and work with others.
As a PhD clinical psychologist, I will contribute my knowledge and expertise to the board of NAMI-New York State. I have a private practice and provide therapy. In the past, I conducted a program that offered psychological services to those children who were homeless and also to their parents. I also have provided talks and trainings and am available to do that to benefit the needs of the NAMI board. In addition, it is very important to me to advocate for needed legislative changes, and I have joined the Government Affairs Committee of NAMI-New York State, and I also co-lead the Committee for Advocacy for NAMI Westchester, and I will continue to fight on both of these committees to make changes.
As a family member, program volunteer, and executive director, board member, I have a long service record in the three aspects of NAMI's mission: support, education, and advocacy. I initiated bringing all of NAMI's signature programs to our local affiliate. I recruited, taught, facilitated, and trained others to carry on these programs. I have presented on a variety of topics related to mental illness to legislators and at conferences, both state and national. I have led support groups at our state and national conventions and presented workshops as well. In my role as executive director, I worked very closely with our board of directors and all of the committees and represented NAMI Rochester on numerous local initiatives, including the Monroe County Office of Mental Health Community Services Board.
I feel like my perspective is a very unique one, being both a younger person and a person of color. The mental health care system has traditionally been focused around taking care of adult patients who tend to be from higher socioeconomic backgrounds and tend to be white. There are a lot of nuances with taking care of mental health care for people of color. I'm a public health student and I'm learning a lot about how social determinants, race, socioeconomic status, even gender play into how people are able to access care. And I really want to bring that into the conversations we're having, the advocacy we're doing, the programs that we're implementing. How can we better serve the entire population that we're trying to serve, the entire state of New York, rather than a specific subset that already resonates with this topic?
Well, as a professional, inspirational, motivational, educational, humorous, and helpful speaker, keynote, performer, advocate, and mental health stand-up comedian, as also a trained and certified peer support specialist with a vast resume in the mental health field. Also, someone that is relatable, who has suffered in silence for over 40 years with his mental illness, but has finally got well and has stayed mentally well now for almost 6 years and is telling everyone how I did it, and so can you. Also showing and telling how everyone can use many of my own wellness tools and especially use humor, laughter, and smiles in order to have great mental health. And also use my important mental health life experiences that were being featured in various TV, radio, podcasts, seminars, and webinars for helping everybody with their important mental health.
There's no time to waste. The future of mental health is now. And it's important for me to help elevate NAMI's presence at the state capitol and build on the amazing work that everyone is already doing at NAMI. I want to make sure that NAMI is thought of immediately when any mental health issue comes across the legislator's desk. I want them to reach out to NAMI and say, what do you believe on this? Help educate me. I believe that's where my personal and professional experience can be of most use to NAMI, and would really look forward to being on a government relations committee. I'd like to place emphasis on services in rural communities as well as with people of color. I think breaking down stigmas, expanding access to services are all challenges I'd like to take on. I hope you'll vote for me and do me the great honor of working with you on behalf of the mental health community.
I say the joke as a teacher that my goal is to work myself out of a job, because as a reading specialist, if I work myself out of a job, that means that all the students in our school are on their own reading level. I would bring that same mentality to the NAMI-New York State Board. And the reason why is because as a board member, I want to work myself right out of that board position, because if I do that, that means that there's no more stigma. It means that we have reached the plateau of all of our advancements, of being able to have all of these services available 24/7, 365 to everyone. My goal is that stigma ends and that people are educated and not only receive the help that they may need, but maybe receive the help that their loved ones need, their friends need. I believe this organization's mission is true. I believe that it is absolutely crucial in today's world. And I hope that, as our organization grows and as we work towards all of these goals, that, we're really going to get that end result, which is going to end stigma, and it's going to bring so much joy and happiness to those that need it.
I really think that the pandemic has weighed heavy and hard on everyone. And I think that education, whether that be our youth or higher education, or even workplace training and development, has all been really impacted, because now we have not been able to, for the most part, be in person in front of people and gather in groups. And I think that the remote instruction and kind of this Zoom life has been helpful to kind of continue services or continue the conversation. But there's going to be some changes that are going to need to happen, and some engagement and some real training to kind of get people up to where they need to be in order to kind of repair that what's been broken. And so I'm hoping that the changes that will come, especially for the NAMI-New York State Board and for just other organizations in general and for the world, is really to support students and anyone who's really open to learning, which at this point I'm hoping is everyone. I am also completing my yoga 200-hour certification as a teacher for teacher training. And I'm very eager to be able to provide some quick middle of the day yoga services and kind of practice to kind of de-stress, get the blood pumping during the day, and hopefully engage and sync a breath with another person, even if it's virtually. So thank you for your time, and I look forward to continuing the process.
For the future of mental health, I would like to see acceptance brought to all those in need, more programs and services for the patients, more support and education for the parents with easier accessibility. I want mental illness to be treated as importantly as a severe medical condition and to be covered by the insurance companies in the same manner. Thank you for your support.
As a whole, I think that the most important thing in terms of mental health is advocacy and a reduction of stigma. I think that the population as a whole has a limited understanding. I think that that's what's one of the most amazing things what NAMI does and really helps with. And I really, really appreciate and hope to help with that direction. But I also hope that there is more of an understanding for the need in the CNS field and research. Most commonly, you go to a medical doctor if you have any particular disease or disorder that doesn't have a set treatment plan. The doctor is going to discuss it more with you and also look into the directions of research and keep up to date. And I don't think that's the case in CNS. I think that in most cases, most practitioners you go to won't include possible research medication. And also the same thing in terms of things like programs and groups. It's not really discussed, even though we do know as a field, we do know as individuals working in mental health, we have a lot of growth and a lot of things we need to still do. I know there's a lot of additional stigma related to research as well. I mean, research always hasn't been the greatest part of mental health, or even medical science. And even though it is part of what drives it and what drives new developments, it needs to be a little bit better understood so people are less afraid of research, and it needs to be better available for individuals to understand and acceptance of it.
Better care for all, regardless inside or outside in recovery. No stigma. I want to see stigma eradicated for both families and peers. I want to see more awareness for the families and peers, and for them to be known as people, not by the diagnosis or the mental illness.
I fervently hope that one day there will be an end to the stigma of mental illness, and that people will be able to talk openly about their illness and obtain the services that they need without being marginalized. I also think it is critically important that there be an improvement with the interface of the criminal justice and mental health system. People with a mental illness should not end up in prison or homeless, both of which happened to my daughter. I also would hope that one day having a mental illness would be no different than having any other illness, and that people will be empowered and have the right to obtain mental health and any services that they would need.
As we head into 2021 during these unprecedented times, mental health is more a priority than ever before, in the mainstream and especially for our loved ones and families. NAMI-New York State has a unique opportunity to continue and heighten our influence and advocacy efforts on legislators, mental health systems, criminal justice systems, and community partners. There are so many issues related to mental health that have emerged during this past year, and the NAMI-New York State Board can lead and direct our organization to address, change, and advance our agenda. Issues such as disparity, crisis intervention, police interaction, isolation, suicide, mental health care, and access to treatment are at the forefront of the public's minds. I am hoping to be part of the dedicated NAMI-New York State Board of Directors in order to continue our mission and improve the quality of life for our loved ones and their families.
I think we need to be more diverse. I think as an organization, NAMI needs to focus on people of color. It needs to focus on younger people. It needs to get mental health care and mental health conversations into communities that we're not previously reaching. And I feel like I want to see a future where I'm represented in the conversations that NAMI is having. Right now, I don't feel represented. I know a lot of my peers don't feel represented, and that's why we don't really resonate with the organization. That's why conversations about mental health are happening so much later in life, when they really need to happen in the teenage years, in the college years, in the years where these disorders start to manifest themselves and start to change people's quality of life.
I totally and finally want to get rid of this terrible stigma of mental illness and treat mental illness just like other diseases like cancer, MS, diabetes, and other chronic illnesses, even just having a broken leg. That mental illness is not your fault, and it's not who you are, and that we are all created equal no matter what is going on with us inside and out. And also, it's all about getting more and more respect for the roles of peer support specialists like me and others to keep telling our mental health stories from discovery to recovery, and in my case, also from recovery to discovery.